Dear all, I have decided to make a more general video which is dedicated to my adult students whom I used to see on Thursdays. I'm really sorry we cannot meet anymore, and I'm trying to find ways in which we can talk to each other. The first thing that came to my mind it was to record this short video in which to tell you that I'm concerned about this unusual situation. I follow the reports every day, and I try to find out as many things as I can about the evolution of this pandemics. This is the first term that I will insist on, pandemic, and I'm sure that you have heard it several times in the last few days. A pandemic is a word derived from the Greek word pan, which means all, and demos, which means people, and refers to a contagious disease that has spread across a very large area, even worldwide, which is unfortunately our case. In the last couple of days, the French have talked about the possibility of a drug, namely chloroquine, which is an old drug used to treat malaria, and which is often used as a potential solution for a new virus. Whenever a new virus appears, they try to see if this does not work, this drug does not work. Apparently, this chloroquine works by altering the ability of the virus to bind to the outside of a host cell. Let's stop and discuss the terms. First, to alter, which means to change. Then the verb to bind, which means to attach or to connect or to join. And last, the noun host, which is an animal or a plant, in our case a cell of the human body on which or in which a parasite lives. So, this drug or medicine changes the ability or the power of the virus to connect or to join a cell in our body. And thus, because of this drug, our cells are not infected and they do not become hosts. By the way, the ordinary meaning of the word host is, as I suppose you know, a person who receives guests in his or her house. I will also say a few words about the most commonly used terms these days, namely quarantine, isolation, and social distancing. In everyday conversations, people use quarantine and isolation interchangeably to refer to separating people in various ways due to the spread of a disease. But for doctors, for public health officials, and other professionals, there is an important distinction between the terms quarantine and isolation. So, the definition of quarantine, and I quote, is a strict situation or condition which involves isolation imposed in order to prevent the spread of a disease. However, quarantine is not just isolation, or it has a different meaning than isolation. I emphasize, quarantine means the separation of a group or a group of people or a person believed to have been exposed to a communicable disease and who do not have any symptoms yet. So they are separated from others who have not been exposed in order to prevent the spread of this disease. But the people who are put in quarantine are not currently sick. We don't know whether they are sick or not. They do not have any symptoms. So on first appearance, they are not sick. They have been exposed, or they may have been exposed to this transmissible or communicable disease, and by separating them we can stop the spread of the disease. So there is of course quarantine, which is voluntary quarantine, when someone isn't ordered to go into quarantine but chooses to do so just out of caution. He is cautious, and this is self-quarantine. The word itself, quarantine, comes from the Italian quarantina, a period of 40 days, and is derived from quaranta, the word for 40. And I suppose you know already that the Italian word comes from the Latin word with the same meaning, 40. So, quarantine originally referred to a period of 40 days which was imposed upon ships when suspected of carrying an infectious or contagious disease. This practice was done in Venice in the 14th century in an effort to keep away and fight the plague. Isolation, on the other hand, is when somebody or someone or a thing is set apart or separated from other people or things because it is infected with a communicable disease, with this transmissible disease. Therefore, medically speaking, isolation refers to the complete separation from others of a person suffering from an infectious or contagious disease. I use this term, contagious, infectious, even transmissible, practically as synonyms. In other words, isolation happens when an infected person is separated from those who are healthy, a person for whom there is clear evidence that he or she is sick. Either they present the clear symptoms or they have been tested positive for it. So it is imperative that they must be separated from those who are healthy in order to stop the spread of the disease. Of course, isolation for public health purposes may be voluntary or compelled by the state, which is our case, and we must respect it. The word itself, isolated, which was first recorded in the 18th century in English, comes from the Latin word insulatus, which could translate as made into an island. So we have to stay isolated. If we are sick, we must stay in quarantine, as most of us are, in order to prevent the spread of the disease. Very many people are quarantined, although they are not sick. They just they don't present the symptoms, but they might have been exposed to the disease. When I say they are exposed or may have been exposed to the disease, I refer to the fact that they may have been in contact with persons who have the disease. And the last term I want to discuss today is social distancing, which has appeared in the context of this pandemic and generally refers to various measures that reduce close contact and increase the distance between large groups of people. There are several examples of social distancing measures imposed by the authorities. For instance, banning, that is forbidding, big gatherings, meetings, the term gathering means meetings, such as sporting events or even courses in schools. And this is why schools and universities closed all over Europe, as well as in some instances authorities restrict people's transit and the travel. You know very well, most of airlines have annulled their flights. Of course, we have the alternative of working from home, which is what we are doing now. So my advice is to work smart and hard, and to take care of yourselves.